before we talk about the National Centre for Veterans Healthcare, I did just want to take a couple of minutes to reflect on the history of Concord Hospital because it's very much informed the future planning of the hospital. So Edith Walker, way back in the early 20th century, demonstrated her commitment to our Defence Force by allowing a camp to be established on the Uralla estate for veterans arriving home from World War I, particularly for returned servicemen with TB. Edith was later named a Dame of the British Empire for her assistance with the Australian Defence Force. After World War II erupted in 1939, the Army identified the site as the ideal for a hospital on the 2nd Military Division, and the trustees of the estate agreed to provide the land to the Commonwealth. Commencing in 1940, the 113th Australian General Hospital was designed and built in record time, admitting its first patients in 1941. And at that time, the hospital was 2,000 beds and the largest hospital in the Southern Hemisphere. The DVA administered the hospital until 1993, when it was transferred over to the state health system.
I have worked here for a large part of my professional career, and I guess I have a corporate memory for the old days when it was a veterans hospital. And perhaps not everyone appreciates what I think is a very proud history we do have about caring for veterans and caring for serving members and also looking after their families.
Everyone still calls Concord Repat Hospital. So if any people that I know, especially from some of the Vietnam veterans that have used services here over the years, they just refer to it as a Repat. We see it as a Repat, and it's been here that long that it's ingrained into everyone who's served, from the origins of the hospital itself to what it did through Korea and Vietnam and helped the Vietnam veterans from then to now, and now to focus that they're looking at the current generation of veterans and the future generation of veterans. It's logical.
So some of the key drivers for planning for Concord's future is up on the slide there. So several years ago, we commenced a master planning exercise for the redevelopment of the hospital. The dilapidated infrastructure was one of the key drivers. Unfortunately, most of Concord's infrastructure cannot be repurposed to continue to provide modern-day healthcare. Despite a number of facelifts over the last 75 years, we really did need some new building stock. Most of the buildings are more than 40 years old, and many of them date back to the original building stock in the early 1940s. Rapid population growth was another key driver, so we're expecting somewhere between 440 to 600,000 people by 2031. This has led to significant increases in activity. Attendances to the hospital emergency department increased by about 50% between 2003-04 through to 2012. We're expecting our ED presentations to rise to 70,000 and beyond by 2020. We need 220 beds approximately by 2026, and this requires a significant investment in infrastructure. But the other key driver that more closely relates to the purpose of our presentation today is the desire from our clinical team and management group to build on our past success in caring for veterans and their families, and to address a service gap for contemporary veterans who have served in more recent conflicts around the world. So the case for change. So there are approximately 60,000 veterans nationally who have served in conflicts and peacekeeping missions over the past 15 years. And probably most tragic of all, more young veterans have committed suicide following their service than the 41 killed in operational combat in Afghanistan. So from the evidence in the literature, engaging with research organisations focusing on veterans, working with NGOs, working with veterans, talking to healthcare providers, and most importantly, engaging with veterans and their families, we found a number of gaps in service provision for contemporary veterans across the country. Some of these are listed there on the slide. A fragmented system with providers working in isolation, uncoordinated care and service duplication, trouble navigating the required services, barriers with services not taking up e-health or other health technology, and difficulty accessing services due to issues such as transport, finances, or language barriers, and a lot of this leads to feelings of disempowerment. So what do veterans and their families have to say? So as I mentioned, we've spoken to a number of vets and their families, and we've got lots of video, but we don't have time to play all of the interviews that we've undertaken, but here's one.
I am a spouse of an ex-army boy, but I'm also the mum of an ex-army boy. So Mitchell joined when he was 17, loved the army. It was his dream. It was all he ever wanted to do. He deployed to Afghanistan at 19 and then again at 21. And by the time he was 25, he had been medically discharged. The ramifications of coming home were far worse. We didn't talk a lot about what happened over there. His relationship broke down, he was having nightmares, he was angry all the time, he was suicidal. So we ended up buying a house just so he had a safe base. We knew that if we didn't do something soon, we were going to lose him. It was such a terrifying time to not be able to be with him. But in terms of being able to actively participate in his treatment or to be able to support him, there was nothing. As a family unit, you need to understand and you need to work together to get through the other side. This facility, whilst it will be in Sydney, will be available for veterans and their families Australia-wide. And I think it will make a massive, massive difference to their healing. Knowing that this facility will be available is going to be amazing. I just wish it was there 5 years ago.
Every time I watch that, I've got to try not to do a Teresa on stage. So through our planning process, we've partnered up with Soldier On to help us engage with our veterans initially. We've now broadened out that collaboration, and that was really to ensure that what we were planning or what we are planning will meet the needs of our patient target group.
Soldier On is an organisation that provides services to those that have served our country either as members of the Australian Defence Force or our national security agencies. We provide employment, education services, mental health support as well as social activities. What we've seen as an organisation that does support that whole remit is there needs to be more support up front in making sure that those who are transitioning out get the support they need to get better employment, transition into better roles and have better family and connections. What is occurring for those that haven't had that support is they're often having social isolation, drug and alcohol issues. Unfortunately, we're seeing high rates of homelessness and also significant rates of suicide within the veteran population. Well, it's going to be a one-stop shop, and that term is often bandied around and used a lot in our country, but in essence it truly is going to be a facility that provides those clinical support through a range of mechanisms, drug and alcohol, physical support as well as mental health, etc., in one location. This concept hasn't really existed anywhere else in Australia. It's started here, and some of the other programs and things that person as a whole unit instead of looking at them as an individual sickness, and that's absolutely critical.
Oops, did I break it, Jay? Nope, there it is. So I'm very pleased and excited to say that in June 2017, government announced a $341.2 million commitment to fund stage 1 of Concord Hospital, which will be completed in 2021. And we've got a couple of our HI colleagues in the audience who have been working with us on this beautiful redevelopment. Hands up. Yeah, there they are. See, they exist, they're here. The enabling works have commenced with demolition and excavation occurring in the second half of 2018. I'm very pleased to say that as part of this redevelopment of the hospital, we will be establishing a national centre for veterans healthcare. However, we don't want to wait until the new building is completed in 2021, and as such, we've commenced planning to establish a pilot service in 2019-20 to further refine the model of care. And there are beautiful architectural pictures of the hospital. I think that's the last one. Yep. So before I hand over to Kirsty, just wanted to put up there the vision statement for our National Centre. And essentially it's to be the leaders in the provision of comprehensive care to achieve optimal physical and mental wellbeing and quality of life for our veterans. I think we workshopped that for about 3 weeks to come up with that, didn't we? That's where we landed. So I'll now hand over to Kirsty to talk in a little bit more detail about the model.
Thanks, Tim. I'm, as Tim said, going to speak a bit more to the model that we're developing. I will also be putting in some videos of clinicians and people involved who are very passionate about this project and who probably speak to it a lot more succinctly than I can. So, as demonstrated so far, there was an identified national need for the Centre of Excellence for our veterans and their families. The National Centre for Veterans Healthcare will tie together a range of specialties to treat the patient and their families together in an integrated service. Care will be provided by psychology, psychiatry, pain, drug and alcohol and rehabilitation medicine, as well as allied health and external service providers. An important part of it is it's going to be case management led to provide the patient and their family with advocacy, support and assist to guide the patient and the clinicians towards the treatment goals. So a pilot service will be commenced next year, as Tim said, with plans to occupy a floor within the new development when it is completed in 2021. When the service opens in its entirety, it'll provide for clinical space, multifunction spaces for diversional therapy, and a functional gym suitable for therapy and recreational use. Now this looks very busy. I've gotten very used to looking at these over the last sort of 8 months, but for you it looks very busy. So just to explain, this is the area where the National Centre for Veterans Health is going to be. It's the old name on it that we've since changed. And down here will be Soldier On, so it's all within one floor, so we can cross-refer to each other to make sure that the health needs and the psychosocial needs are met at the same time for the patient and their family. So existing silos, as we all know, exist within the healthcare system and between relevant external support systems, which makes it hard for those in need to identify and access services critical to the effective management of their collective symptoms. In order for healthcare to be effective, sectors within and outside of the health service need to be engaged to support and promote whole of patient care. So statistically, about 12% of this general Australian public are estimated to have both mental and physical health problems. These statistics are even higher in the veteran community. Due to this, it is important to establish effective integration with mental and physical health care and also engaging with GPs and primary health providers to develop innovative service models. Coordinating primary care and mental health care in this way can help address the physical health problems of people while addressing the psychological issues concurrently, allowing us also to interweave other important services including allied health to ensure that the care providers work towards the same set treatment goal. We will also, at the implementation of the clinical treatment plan process, develop links to services that assist in the psychosocial aspect of the veteran and their family's recovery, so that these recovery pathways and links are established early and in line with the clinical goals.
Health is health. That's always been the message that I've been able, as a psychologist, I look at the person that stands in front of me, and that person has health concerns. They might be physical health concerns, they might be mental health concerns, but that person is also part of a system and a family. And so you need to be able to treat that individual and assess the needs of that individual and be able to provide a comprehensive service that wraps around that individual, where the individual's at the centre. And that's what we're going to look at doing with the National Centre for Veterans Healthcare.
I think the National Centre for Veterans Healthcare, from its very beginnings, everyone agreed this has to be a multidisciplinary approach, that the veterans are going to be experiencing mental health problems, they are going to be experiencing drug health problems. Many of them will have physical disabilities, chronic pain, some also traumatic brain injuries. So it'd be just impossible to be able to offer them good care unless this was an integrated model. So we're all working together.
So that if we can integrate services to be able to meet the needs of veterans, and they are complex needs, they are physical health needs, they are mental health needs, they are social needs as well, and family needs. So if we can do that in one location, then we are unique. Look, I believe that peer support for the veterans in the National Centre for Veterans Healthcare will be an essential part of providing a very comprehensive service. We know that the evidence base is there, and that these are people with their lived experience that will offer a very unique type of support to veterans that the health professionals can't.
Military personnel and veterans dealing with complex issues such as post-traumatic stress disorder or substance misuse will have a long and, in most cases, hard struggle as they navigate through diagnosis, treatment and recovery. Through all of their assessments, therapies and medications, family support is often seen as one of the most important aspects of treatment and recovery. The Department of Veteran Affairs Veteran Mental Health Strategy 2013 to 2023 recognises that supportive families can help protect mental health and encourage help in seeking medical treatment when it is required. Evidence also suggests a high prevalence of mental health conditions for partners and children of veterans compared to that of their civilian counterparts. Being able to have the family present during treatment will not only allow us to treat the patient, but aid in the recovery and treatment of the family as a whole unit. As not all veterans reside within the Sydney metropolitan area, and this is a national service to assist with veterans Australia-wide, we recognise the need to be able to offer a veteran and their families the chance to be present and included within the treatment phase. Anecdotally, when we have met with members of the tri-service community, we heard that a barrier to seeking treatment is often the necessity to be away from their loved ones for a long period of time.
When anyone suffers chronic pain, when anyone has a disability, which is very severe, it does not just impact upon the individual. It impacts the people around them, their loved ones, just as much as they impact upon the individual.
And a lot of families do feel alone because they lose the same support networks when they discharge from the military as well. And that is one thing that this centre will be encouraging for them because they know they can seek the help as well and they're not forgotten.
So I think for the family to be involved is important for the veteran, but I think it's also important from their perspective as well. We're seeing them as part of the picture, as really experiencing secondhand a lot of the traumatic experiences that the family members have been through. And we're going to have to be there for them as well as for the veteran.
So for us it'll be very important, I think, to work with the families as well and to work with the children. If you look at trauma from the perspective of the primary victim being the veteran, they experience the trauma firsthand. We then have the family members who experience the trauma in a secondary way through the eyes of that person, and they're coping with the aftermath.
families and spouses will be excited for it, because that's one of their biggest complaints, that all the effort is for the partner who's served, be that male or female, and that they're forgotten about. And at the moment, the only way they're being looked after is some of the ex-service charities are supporting them here and there, but their health is affected by their partner's health. The children are affected by their partner's health.
So the accommodation service with the National Centre for Veterans Healthcare is a fantastic example of looking after the family unit. That's what it's about. You can't just treat the individual, you need to treat the system that they're in. And so the family being there offers them that containment, it offers them stability, it offers them support, emotional, physical, and it means that we are able to actually access and do better assessments in order to treat that individual.
So as Lil just mentioned, a pivotal aspect of the model of care is the access to residential accommodation for their families and the patients. In order to provide ease of access to out-of-area veterans and their families, appropriate accommodation is essential. The proposed service accommodation will consist of single and twin ensuite rooms, family ensuite rooms, hotel-style facilities, and the accommodation will incorporate living and dining spaces, quiet areas, activity spaces and outdoor recreation spaces to accommodate the needs of singles, families and their children. It is essential at the beginning point of the patient's referral and treatment, a patient-centred collaborative management plan is created with the multidisciplinary team, the case manager, the patient and their families, with the aim of developing goals and early planning for discharge, referral and ongoing support. This early collaboration with the patient and their family will likely improve responsiveness to treatment and prevent cyclic treatment processes. The service will build and maintain a strong relationship with community healthcare providers, utilising information technology such as telehealth and online forums to ensure continuity of care for those residing in regional and rural areas. Clinical supervision can be provided to upskill and allow the GPs within these regional and rural areas the ability to confidently treat the veteran within their own community. The ability for the veteran to continue treatment whilst in the surrounds of their own community will not only aid in health recovery, but also allow ongoing improvement in the psychosocial aspects of their recovery, including local social, educational and employment opportunities. The aim of this hub and spoke model of integrated care and ongoing community support is to ensure that we are able to form a national network of care providers who have the skills and confidence to assist the patients and their families in the rehabilitation needs within their own community.
The model that everyone agreed on was that it would be incredibly important to maintain contacts with resources in the areas where these people have come from. That they, particularly people from out of Sydney, we will have to be drawing in as partners their general practitioners, other health providers in those areas, also their families. So unless there's that continuity of care between the National Centre and the environment that these veterans are returning to, we're just going to lose any sort of improvement that we've been able to achieve here.
Veterans that will be accessing the service, the National Centre for Veterans Healthcare, are not going to be people just from Sydney. They might be from rural and remote areas, and they have to go back to regions where they may not have the services that we have in the city areas.
The care of the veteran and the families is by necessity have to be an ongoing one. At the National Centre for Veterans Healthcare, we propose a model of ongoing care whereby the veteran has initial comprehensive assessment and initial treatment at the centre, followed by our ongoing support of the veteran by providing telehealth support and medical advice to the local healthcare providers.
And so for us, to ensure that there's continuity of care and that that person is well supported once they leave the National Centre for Veterans Healthcare, it's important that we collaborate and we work with the healthcare providers in whichever region they're moving back to. And that might be through telehealth, it might be through offering clinical supervision to, say, young psychologists or psychologists who are in rural and remote areas that might not be able to access that sort of support. It might be through education and training. But I think it's critical and it's essential that we don't offer all the services in the one spot and then forget that they actually go back out somewhere where the level of services don't exist.
So just to finish, I did want to say, oops, that's right, the next chapter. Oh, the next chapter.
What I find passionate about this program, not only the involvement of the staff and their passion and the level of expertise that these people are bringing to this centre, I get excited that we can put up a hand and say this is a centre that focuses on the welfare of veterans.
But I think what I'm really excited about is that it's unique. We're really looking at where we can fit in to a system that, and there are lots of systems that offer veterans health care. What we're trying to do is offer something that is integrated, that places that individual at the centre, and then we wrap around that individual and wrap around that family. And that's what I'm excited about.
Since I've been helping with the program, I'm surrounded by caring people who want to help, and it's encouraging, it's exciting.